topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, New York. Welcome to another Ask the Expert show, where we bring you the top experts in the field of legal, health, financial, and home improvement. Hey, this is our 16th year of providing you the greatest experts. Our show this morning is such an important show and is very dear to my heart because I'm on Medicare. I'm not afraid to admit it. And I got to tell you, I love Medicare. I think it is definitely worth all the money I have put into it. It has saved me so much money. But let's bring on an expert that we just got a phone call right before the show. Let me bring on Dan Alcorn of Alcorn and Associates. He's here with one of his associates, Alicia. Good morning.
Good morning, Steve. Thank you for having us this morning. Hello, Alicia.
Good morning.
I got to tell you, I love doing your show. I liked, we do a live show because I think live is so much more, I guess, when it comes to seeing a reaction. And I got a phone call. We promote your show several days out. And a lady called us about 45 minutes ago, and she said, I was strolling through what's coming on YouTube today, and I saw where you got Alcorn and Associates on. They handled my mother's Medicare, and she didn't give me who did it, because I know you've got many associates, but she said they were so good. They were so understanding. And I want people out there to know, because there's a lot of agents out there, that Alcorn and Associates are the best. I was shocked to get a call right before the show, but I waited to share it with you when you came on live.
They had to be talking about Alicia.
Yeah. At her fireplace and piano.
Yes.
Well, that's a great compliment. Yeah, thank you.
That was so nice. Dan, tell us about Alcorn and Associates.
So we are a team of licensed independent agents, which means we don't work for the federal government. We're not employees of any particular carrier. We are authorized to represent, and we choose which companies we represent. Medicare Advantage and Medicare Supplement plans. We're all based in New York State, from the Canadian border to Long Island, although we do operate in other states as well, like Vermont, Massachusetts, New Jersey, and of course your home state of Florida, Steve. So we work together and support each other as a team. And more importantly, we help our clients, those who are about to enroll in Medicare or those who are currently enrolled in Medicare, navigate their way through this maze. It's a changing landscape. Last week, the CMS, Center for Medicare and Medicaid Services, announced that the 2027 funding is essentially flatlined. And with providers expecting more and consumers expecting more and cost pressure, we anticipate more disruption in the marketplace for next year. So we're expecting that, what the status quo of Medicare Advantage plans may be disrupted next year. And we're having greater interest in these old-fashioned Medicare supplement plans. And so the timing of our call today is really spot on.
Well, I've got to ask this since I'm on Advantage here. What are the disruptions you're talking about?
It's always the money. The federal government is, historically has been funding these Medicare Advantage plans 5 to 8% increases each year. For 2027, CMS proposed next year to be under 1%. So the Medicare Advantage carriers are responding that, with cost pressures, they're going to have to, if that goes through, curtail benefits, exit markets. I operate as well in northern Vermont. There's some counties in Vermont where there are no more Medicare Advantage plans even available. In northern New York, there were companies that exited certain counties. So we're seeing a lot of cost pressure and not sure what next year will be like. But part of our show today is to talk about a plan that may be attractive to folks in this disruptive market now and next year as well. Believe it or not, we just went through the annual enrollment period for 2026, and here we are talking about what's on the horizon for next year.
Alicia, we get a lot of texts from your show, people wondering at what age should they start contacting you?
Well, as soon as they are getting eligible for Medicare, and most people, it's the 65, the 7-month window they have, or there's like 3 months before their birth month, and then their birth month, and then 3 months afterward. Some people already, they don't have to worry about that because when they're taking Social Security retirement, if they've been taking that, the system knows that, okay, so-and-so has been getting retirement benefits. They're turning 65. You don't have to do any automatic. It's automatic. They don't have to do any applications for Part A and Part B. Now, there are people that are working, right? Most of us, unfortunately, I think in my age category, will be working past 65, or some people just don't want to retire. And then, they have options in terms of whether or not they are going to take Part B, as in boy, because, if they have coverage with their employer, that has, certain advantages to that. So it really, if you're taking Social Security retirement already, it's not that much to do. But if you're working or not taking retirement benefits from Social Security, when you're 65, 64 and a half, you really should start contacting.
And Alicia touches on a great point, Steve. When you turn 65, you're not required to enroll in Medicare. I say to folks, you're at a point where you now have an option. You can stay with your employer plan, as Alicia pointed out, or enroll in Medicare. And then it really comes down to Medicare math. Which one makes more sense for you financially? It's a great place to be in because you have options. So, but if you have any questions, even if you're 62, call Alicia. She'll steer you, direct you, guide you through that maze.
Dan, one of the things, and Alicia, one of the things I want people to understand, because I thought I was one of the only people who didn't realize when I could apply for Social Security. It took a friend of mine, but after doing your show and some other shows on the West Coast now, there is a lot of people who don't understand. And when you don't understand, it can become, is like it did with me, very costly on penalties.
Mm-hmm.
You mean late enrollment? Yeah.
Yes.
Yeah, absolutely. So you want to touch that one, Alicia? The late enrollment penalties for both Parts B and D. Yeah.
Yeah.
Right.
So, as I was saying with the Part B, if you're covered under an employer plan, and it doesn't have to be you working. I should say if you have a spouse that's working and you're able to still be covered, you have to make sure. I would say even with that, you should double check with the human resources just to make sure that everything is in all ducks are in a row and you're good. And Part B, you have some time when separation of service, happens to get into a Medicare situation. The Part D is in dog or drugs. That there's a penalty for late enrollment for that, and actually that one is only 63 days. You only 63-day window to get into a Medicare Part D plan once you've either become eligible, by way of losing coverage from another plan, or if you're just turning 65 in your initial enrollment period. So you really should pay attention. The Part D, and also there's a thing called creditable coverage. So if you have drug coverage from another source that is as good as what Medicare offers, then you don't have to worry about that. But that's documentation that you could get on that from your plan. But there are penalties, and those penalties will last. They don't go away. There's no aging out of it. And there's different formulas on how they're calculated. But there's only certain circumstances where you can get out of that. And it's usually if you get financial assistance.
And an example of that other creditable coverage, let's remind folks, Alicia, is that Veterans Administration,
Yes.
if you're eligible for prescription drug coverage through the VA, that's as good as or better than Part D. So, the penalty wouldn't apply there. So,
right.
Great question. Thanks, Steve.
Well, I'm always learning something new from you. Now I've learned that there's a Plan G. Why do people choose high deductible Plan G supplemental, say, versus the regular Plan G?
So we're not talking Medicare Advantage. If you are with original Medicare, I call that the 3-card solution. Original Medicare, lots of folks have the red, white, and blue card. They would have a drug card or VA coverage, as Alicia pointed out. That's their second card, their drug coverage. But original Medicare doesn't cover everything. It's not 100% financial coverage. So there's a deductible for hospitalization. There's a deductible for Medicare or for medical services. And then there's roughly an 80-20 split, meaning the government pays its 80% and you're responsible for 20%. That Part A deductible and that Part B deductible and that 20% part can be covered through a supplemental plan. Now, in the government's wisdom, they named these supplemental plans alphabetically like Medicare. So there's supplemental plans F, G, N, C. F is for folks who are eligible for Medicare 2020 or earlier. So that's the finest plan you can get if you're old enough. G is good. It covers everything but the Part B deductible. And then the next one we talk about is N. We have that on our website. Let me see if I can bring that up so our listeners can view that. Can I? There we go. So there's a Plan G, but then there's also a high deductible Plan G. We actually talked about it in one of our previous sessions. One of the reasons for that people would do that, Steve, is that this Plan G has a maximum out-of-pocket of $29.50 per year. That's not first dollar. That's your maximum out-of-pocket. And with many of these Medicare Advantage plans, your maximum copays on an annual basis can range from $6,000 to $9,200 a year. But also take a look at traditional Plan G to answer your question. Approximately, depending on where you live in New York State, a Plan G premium on that can be about $400 a month. Plus, you pay that Part B deductible. So your premium and deductible costs could be $5,083 a month. A year. But with the high deductible, that premium is not $400 a month. It's about $75 a month. But you pay that Part A and Part B deductible and that 20% cost share up to a maximum of $29.50. Compare that maximum of $29.50 to the Medicare Advantage plan. Again, you're saving quite a bit of exposure there. But mathematically, The traditional plan G, $5,083 with a high deductible G. You've got a premium, you've got some copay exposure, but the maximum is $3,850. That's a big difference
Yes.
in annual cost. What we recommend folks do is the money that you're saving in the premium, take that $250 or so, set it aside to cover that $2,950 and that $2,950. And as I like to say, depending on your claims history, you should have money left over on December 31st. So it's a way to manage your exposure, and it's also a more cost-effective way than compared to traditional Plan G. And by the way, on our website, we list what the Part A, Part B deductibles are. I look at it as a $2,950 cap on your out-of-pocket expenses. And with, healthcare can be one of the greatest financial threats to your retirement savings. With these Medicare Advantage plans quietly having, it's called MOOP, maximum out of pocket, $6,000 to $9,000 exposure. With this, your exposure is $2,950. That's the answer.
So does a member pay first, like with car insurance, before Medicare or Plan G?
No, and that's a common misconception. They think they hear the word high deductible, $2,950. We think, well, I paid the first $2,950. That's not necessarily the case. Let's say you were going to the doctor. You would pay that first $283. After that, after you've met that $283 deductible, your healthcare costs, let's say you have another $500 worth of expenses, lab work, imaging, follow-up visits. That $500 additional, Medicare, remember, is paying 80% of that. So that's $400 that Medicare pays. The 20%, that $100, is what counts towards that $2,950. So it's your share capped out at $2,950 as opposed to first dollar. It's a great question, and it's. I wish they didn't call it high deductible. I wish they called it, maximum cap or maximum out of pocket, because that makes more sense. But it's your exposure. Your copays are capped at $2,950. It's the deductible and the 20% piece, maximum of $2,950. Add that to the premium. It still is favorable compared to a regular Plan G. And of course, the exposure of $2,950 is significantly lower than what it is with a Medicare Advantage plan.
And will hospitals and doctors accept this?
What have you found, Alicia?
Yeah, they will accept it. We have the good thing about the supplemental world, you don't have to worry about networks like you do with Advantage. And, as long as the doctors or hospitals participate in Medicare, and, it's like, what is it, Dan? Like over 90% probably of the providers or more in the US accept or participate in Medicare. So that's not a concern, that's not a concern. And all of that happens behind the scenes, sort of a seamless process to the member, because, Medicare gets the claim, and then they know, you have so-and-so company, and it just, the supplemental part, when it's time to kick in, that will kick in. But yes, they will accept that.
Exactly. Medicare is your primary.
Still the primary.
You bring your Medicare card first. Mm-hmm. So to answer your question, will hospitals and providers accept it? They are accepting original Medicare. Yes. Behind the scenes, as Alicia pointed out, is where your supplemental plan, whether you have a Plan F, Plan G, Plan N, high deductible, that's all behind the scenes. So we've had no issues with providers saying, I don't know what this plan is. And some of the high deductible providers here in New York, Humana offers a high deductible supplement plan. Globe Life, which is a nationally known firm, does as well. So these are name brand companies, but they're behind the scenes to original Medicare.
So if someone's already enrolled, say, in a regular supplement plan like FG or N, do I still have to wait until January of 27?
Go ahead, Alicia.
No. Luckily, well, no, you don't. And the New Yorkers, there are some good points about being in New York. This one of them in this case is we have open enrollment, so to speak, all the time, and there's no underwriting. So other states, there is when you do change supplements, there are sometimes medical underwriting. But in this case, in New York, we don't have that. So there is no need to wait. If you just want to switch the supplemental portion of your insurance, there is no need to wait. I have people thinking about this now who've kind of, they didn't want to move in annual enrollment period, but I have someone who he's like, I haven't gone to the doctor in so many years, so he's staying with his traditional, but he said, you know what, if he tells me that I'm pretty healthy and he doesn't expect me to come back, I'm going to look at the high deductible. And
absolutely right.
And I told him, I said, yeah, well, get that appointment and then let us know, let me know,
Sure.
what you're going to do. So, he's able, if he wants to move in March, or next week or whatever, like he has that option. And so
New York, to Alicia's point, has continuous year-round open enrollment,
yes,
guaranteed approval, so no underwriting, and community rating, which means that the premium is not based on your gender, your age, or your health condition. It's based on the community. So like the premiums in the Metro New York and Long Island area are a little different than they are for the Buffalo regions or, North Country. But that's it. It's continuous open enrollment, guaranteed approval, community rating, which is, to Alicia's point, really unique and advantageous to New York residents.
Dan, tell people how they can reach you.
www.dgalcorn.com. The office number is 518-346-2115, where you can get word to myself or Alicia or any one of our team members from the Canadian border to down in Alicia's area. Alicia is based in Metro New York, Long Island.
And I promise you, since Dan and Alicia will be back with us again next month, I promise you, Alicia will play her piano for everybody.
I don't know if you want to hear that. I'm going to lose some listeners.
I think you guys will be back with us again next month. What a great show. Great new information. Hey, stay warm. We'll see you next month.
Thank you, Steve. Thank you, Alicia. Everybody have a great day. Take care.
We're going to go to break. We'll be right back.
All right. Bye-bye now.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.